Hey everyone, welcome to day number 3 of Mouth Breathing Awareness Month. I have another MyoMentor graduate joining me today. Her name is Laael Johnson, and she's from New York, like small town New York, and I can't wait to have her. Yay, look at everyone. I can't wait to have her share her story because she's actually going to be connecting it to more of a mom's perspective. So she's going to be talking about breastfeeding and tongue ties. And oh gosh, Laael, if you're on there, say hi or something so I'll know when to bring you on. But I think, connecting the dots between mouth breathing and breastfeeding and tongue ties is a really big deal. And I think that's what she's going to be able to do for us today. So, all right, Laael, where are you? I don't see you yet. Maybe I don't know your screen name. Oh, there you are. Yay. Okay, I'm going to click on you. Notification. So here she is. Hi, Laael. Good to see you. Thanks for joining me.
Hi, I think I can hear you better here.
Okay, yeah, put in your headset. Whatever
There
works.
we go.
Yeah, thank you so much for doing this. I think it's really good for parents to know this isn't an issue that is only for adults, although I've talked to adults mostly so far.
hmm
But why don't you go into, well, first of all, introduce yourself. You're a hygienist, myofunctional therapist. Let's say who you are first, and then you can kind of talk about how you got into this field, and then
Okay, awesome. Yeah, my name is Laael. I have been a hygienist for 11 years now. And myofunctional therapy actually got brought to me. A hygienist that I worked with for a really long time moved out west. And when she came home to visit for Christmas, she's like, "Hey, have you heard of myofunctional therapy?" I'm like, "No, but tell me more," because I'm definitely somebody who always wants to know more. So she kind of got me looking at different courses and things like that, and that's how I found you. And then after doing your program, I kind of light bulbs started going off for my family, and yeah, and then that's how my story started.
yeah, start with your son, and then I do also want to ask about
Yeah,
your husband a little.
yeah,
Because
yeah, sure.
mouth breathing affects all ages. And I always
hmm
have to say, we think of it as such a simple, mundane, like who really cares if you breathe through your nose or your mouth? But it's a red flag for bigger issues, and it's connected to so many other health concerns that's why I'm talking about it, and that's why I'm trying to spread the awareness with this whole mouth breathing awareness campaign. So
Yeah.
yeah, let's start with your son and talk about his journey and story.
Yeah, so my son, his name's Maddox. He's 5 now. But our initial breastfeeding story, he was my firstborn, and my mom breastfed me and my brothers were until we were 2. I mean, for a pretty long time. And she was kind of my support and saying, like, this is the best, this is what you need to do. But even 5 years ago, my thought was, okay, well, antibodies. That's why I'm doing this, to make sure that they're getting antibodies. And now we know, obviously, it goes so much more past that. But
Yeah, into
so
right.
I started out, yeah. He started out in the hospital. I think from the minute he was born, he was just not a happy baby. He was healthy. I didn't get much breastfeeding support from the nurses in the hospital. I don't think the education where I am is really quite there yet. I know that there are a few that are really trying to make this easier for moms here, but we're a little bit behind for sure. So I kind of had myself to figure this out, and a couple days into his life, I'm breastfeeding and super engorged, huge oversupply. He Everything was painful. I mean, I was bleeding every time he wanted to eat. I'm like rolling my eyes, crying.
Oh,
Postpartum depression, because like here I am like trying to feed my son and I don't want to feed him because it hurts. I think I was at the pediatrician every other day. Like something's not right. It's hurting. He's crying all the time. He was super colicky. Um, I think right around maybe week 5 or 6. So I kept going with what they were telling me, and he would. I kept doing it because I'm a determined person, and I was using all the creams. I mean, cabbage leaves, walking around with ice packs. I mean, my husband probably looked at me like I was insane. It was not pretty whatsoever. But yeah, and then I think right around like week 5 or 6, they came down with what I thought was just the flu, and it turned out to be mastitis. Um, yeah, it turned out to be mastitis, and I can treat that myself as well, of course. So, I didn't go to the doctor. I kept trying to feed him. It got worse and worse. And by the time I went, it was an abscess, and they had to do a draining. And all of this time, there's still nobody checking him for ties. So I guess that's like my biggest thing. And we were able to,
So really quick, Laael, just in
yeah.
case anyone's listening, when you say ties, kind of go into what you're talking about more. Lip ties, tongue ties, buccal ties.
Yeah.
And then
Yeah. So
connect it back to what you know about mouth breathing as a myofunctional therapist. There's people probably listening who don't know any of this stuff. So
right. So his lip basically, it prevented him from flaring out the way it's supposed to latch onto the breast to begin with. His tongue tie prevented his tongue from rising to the roof of the mouth to pull the milk correctly, which then he was not swallowing correctly because his tongue was not moving in the correct position as well. So, right now in life, he's doing well. We're still going to have his tongue ties addressed because he's always been a congested kid every winter. I mean, I think he had a bronchoscopy where they do a scope to look to see in his airway to see why he was always producing postnasal drips, things like that. So, he breastfed until he was 2. Again, nobody saw the ties, though, the tongue tie and the lip tie and all of that. So, yeah, that's his story.
yeah,
Our
so
story.
after, he breastfed until 2, you kind of struggled your way through, like you did. Nice job. How much were you supplementing the bottle?
Nothing. Well, when I went back to work, he was getting bottles. I mean, he never had to go on formula.
Wow. Oh my gosh, you
it just to me,
hard.
Yeah, I'm definitely proud of our story. Looking back, it makes me sad that there was nobody to see these things because it doesn't have to be this way.
Yeah.
I just had a friend have a baby, and she's like, yeah, it hurts. And, she sent me some pictures, and I'm not a lactation specialist, but when you've been through something like this, so one of our local pediatric dentists who was trained with Dr. Cutlow on ties, she was able to do her son's tongue tie, lip tie, cheek ties, and she texted me immediately after. She's like, it's so soft. I can't believe he's nursing and it's so soft. And she had mastitis, I think, 3 times in a month. So,
oh my goodness.
Yeah.
I'm not a mom. I have not experienced this, but man, I hear these stories all the time. And when I get the patient when they're, 5, 6, 7, 8, 9, 10, and they're still kids, and I'm asking the mom about this history, this comes up so much. And what people don't realize is that when you're tongue-tied, you're way more likely to, like you said, your son, he's having these bronchial issues during the winter. You're tongue-tied, you're more likely to mouth breathe. And it doesn't sound like the mouth breathing has been like a huge thing for your son, but even if you're just doing it a tiny bit or only at night, then it can lead to that cycle of congestion and sickness, which leads to mouth breathing. And so there's so many tongue-tied people who also mouth breathe. And that's, again, why I think this mouth breathing awareness thing is so important, because we all know tongue ties aren't great. I think that's gaining awareness, but people don't realize the connection between mouth breathing. So, yeah.
Yeah, and I can just imagine all the compensations that he did from the minute he was born, and he probably still does, that, we'll have to play catch up at this at this point, but at least he has a team that knows how to catch him up. So
Yeah, no,
yeah,
that's
that's
you're making such a good point is that even though you were able to breastfeed, your son was compensating a lot in his ability to actually nurse effectively. So that from an early age sets up kids with these dysfunctional muscle patterns. And
hmm
it affects the way their jaws and teeth develop. And we see it in dentistry, but we don't realize that so many of the things that we see in dental offices relate back to breastfeeding and babies, right? So
hmm
things start early. Yeah.
yeah, for sure.
Do you want to talk about your husband? I know you mentioned that just a little.
Yeah. He's gonna watch this and be like, "So you're talking about all my problems." um,
They don't get
so
addressed in like when you're a baby or a kid. I mean, they don't go away, right? Like
yeah, and
they're
now
there.
he's an adult, and he was actually, this is interesting. He was the only child out of five that was breastfed.
Wow.
So there, you just, who knows if he had ties that weren't addressed, which I'm assuming he kind of pushes me away a little bit. I'm working on him slowly. Um,
Mm-hmm.
yeah, but during the class, there's the class that I took with you, there was some boxes that I just kept checking, and I'm thinking of him the whole time. And then I'm looking over as I have my headphones in and I'm studying and looking, I'm like, he's mouth breathing. He's watching TV. I'm like, close your lips. And he's like, why? What's the big deal? Oh boy, here we go. Okay, well, so
Yep.
come sit. We're going to have a lecture. So he mouth breathes. He has allergies. He had braces much later in life,
hmm
but they extracted teeth. So they
Okay.
made his jaws smaller. So now what the plan is, started doing myo maybe about a month ago. And I want to get his tongue resting up into the roof of the mouth where it needs to be,
Good.
and hopefully get some kind of expansion. There's a great orthodontist that we have about an hour away. She's very airway focused, so he's going to be hopefully working with her and doing the mechanics of everything, as long as the tongue is resting where it should.
So do you think your husband has any of I always describe mouth breathing as kind of it's a small problem when it starts, but it can lead to bigger things down the road. Like, have you noticed any snoring, or does he have any, I guess, other than, like you said, kind of the narrow palate, maybe smaller mouth or less space for the tongue? Does he have any bigger signs like snoring or sleep disorder breathing that you're aware of? Maybe he's not, but have you noticed anything else?
Uh, he doesn't snore, but his mouth is open, and I find that he's always all over the place when he's sleeping, and he'll say that about me, I'm sure. But he really is. Sorry, he really is. And his allergies really bother him. He's very sensitive to medication, so really I want to try to get him off his allergy medication. He's so sensitive. He has to take it at night because it'll make him
Yeah.
drowsy, even though it's not a drowsy medication.
Yeah.
He did do a couple nights of the breathe right strips.
Oh, good. Those can be really
I
helpful.
Yeah, without, stalking him all night long, I think that he felt better. But I'm also trying to do this without, he's going to watch this and know my whole plan. But I don't want him to know too much. I want him to see how he feels without me telling him how he
Yeah,
feels.
no,
Because
that's
I'm really good at doing that.
um, well, so I think, yeah, I mean, starting where you can with family, it's so hard, but you're doing awesome, and I appreciate. You'll have to thank him later for me, but I appreciate you sharing that story because people don't realize that when you have allergies and you're used to mouth breathing, if you can change your breathing
hmm
and start to use your nose, your allergies will actually affect you a lot less. Like they will go away or at least be severely reduced if you can switch from mouth to nose breathing, which is amazing. I mean, that in itself, it's just crazy that you can actually kind of cure your allergies just by nose breathing. So,
Yeah, and I don't have allergies myself, but any
mhm.
patient that I've ever talked to that has allergies, it's uncomfortable. They're
Yeah.
uncomfortable all the time. The medications that you take to cover the symptoms, which is not treating what the true problem is, those medications don't always make you feel the best either. And
No, yeah.
that's always, you want to be on your A game, you know?
Yeah, exactly. Well, thank you
Yeah.
so much, Laael. Is there anything else you want to add? Because I want people to look you up. You're in New York, like Plattsburgh, so
Hmm.
north, like almost up to
Yep.
Montreal, right? And
Yes.
small town, but you see people
Yes.
online. So you got this
Yes, I do.
down, and
Yeah.
I know that you've got some awesome an orthodontist near you, and somebody who's looking at tongue ties near you. So I think
Yes.
someone who's a patient who wants to reach out and work with Laael, please do that. Find her. I'll
Hmm.
link all your social media stuff when I post this on YouTube, and we can share.
Okay.
But if there's any professionals watching who want to work with Laael, please start forming these teams and working
Hmm.
together, because there aren't a ton of us out there who are aware of all these components of dentistry, and I think it's good when we can all work together and help our patients. And I really appreciate you sharing your story, because now
Yes.
anyone who watches this is going to understand, okay, wow, this is actually pretty common. So
Yeah, and again with the breastfeeding, for something that is so supposed to be so natural, it's so much work. It really is, and um, it's worth it. I mean, he was 2 before I finally got him to stop. But now, just even with the provider that we have, I'm going to give her a shout out, Dr. Colleen Senecal. She's in Plattsburgh. She is just amazing, and she's trying to even work within our hospital here to get the OBGYN, the nurses that are working on the OB floor, looking more at these things and trying to get these kids before they turn into, my husband with
yeah,
mouth breathing issues.
well, we
Because
see it.
it's a matter of time.
And yeah, we can catch it at any stage of life. Obviously, the younger we can correct these things, the better. But
Hmm.
yeah, mouth breathing is a big deal, and that's why we're talking about it, and that's why we're talking about everything that goes along with it too. So thank you,
Hmm.
everyone, for joining us on day 3 of the Mouth Breathing Awareness Campaign for this month of May. We're going to be interviewing, or I'm going to be interviewing and talking to MyoMentor graduates who are all dentists and hygienists and other healthcare providers who want to share their personal stories, because we all have them. That's kind of how we get into this field.
Hmm.
So yeah, thank you to everyone. Thank you so much, Laael. I hope
You're
everyone
welcome.
connects with you, and I'll be talking with you soon.
Thank you. Bye, Sarah.
All right, bye everyone.